Well, Melanie, thank you so much for joining us. Thank you for taking time out of your busy schedule. You lead a large team, so we appreciate it.
I'm really excited about it. Thank you, Timothy, for having me.
Absolutely, absolutely. Let's jump right in. First question I like to ask all of our guests is if you could share the story of how you got involved in behavioral health, how you ended up in this career, because it's not an easy one. I know.
It is not an easy one, and I do feel like being in behavioral health is a lot of a calling. I would say that one thing that was impressed upon me early is I have a uncle who was a Huey crew chief in Vietnam, and I was at a young, impressionable age during his time in service, and it was really difficult. And so I actually saw the cascade of trauma that happened once he came back home and tried to reintegrate, and I've continued to watch that and just the impact that's had on his life. So that was probably one of the first things that was really impressed upon me. And I actually like to say that I think their life has these tenderizing moments that make you more sensitive and compassionate to what's going on out there. So that was one of them. And then just through life, I think I was just probably made that way. But when I went into my bachelor's degree, my bachelor's is actually in business administration, and I was a focus in marketing. And I really got interested in sort of the behavior of consumers. And so that kind of led me down the behavior path, like what makes people make certain decisions. And so as I got out, I actually really didn't find a track that was exciting to me. So I went back and got my master's degree in behavioral health, in counseling specifically, became a licensed professional counselor. I've worked in lots of different levels of care, including managed care at one point as well. And, just really found my home there and have spent, I guess now close to 38 years working in behavioral health.
Wow, that is awesome. That is awesome. And congrats on getting a marketing degree and then getting it and then doing anything except for marketing, because that is often what happens.
Yeah, for
That's
sure.
very cool. That's very cool. So what are some of the biggest gaps in mental health care access, especially? And I know that's one of the things that you and your team are working to help close.
Yeah, so my team, we specifically, we're kind of qualified as a community mental health center. And so we serve some of the most complex individuals with tend to have multiple social determinants of health that are impacted not only their mental illness, but sort of their housing status. And so again, a very complex needs. And I think, and even just as a CEO, the kind of calls that I get are just people who have a hard time navigating how to get into behavioral health and who do you trust. And so trying to create a level of, again, it kind of goes back to some of the marketing. How do you get the information out there about who you are, what you do, and that people can actually trust walking in your door? That's, if you sprain your ankle or break your wrist or an arm or something, you pretty much know what that episode of care is going to be. But when you need to talk about some of your deepest, darkest moments that may be painful to discuss, where are you going to land with that? Who is going to listen to that? Who wants to listen to that? And who wants to help? So I think just engaging people and creating easy access is something that we're always really, really challenged with, and instilling in our communities that you can just walk in the door. I think that's the hardest thing when you're looking for behavioral health services, right? Is just getting through that front door. So we try to make it as easy as possible of how we engage people and how we actually put staff out into community settings to really engage people in very, very different ways.
Absolutely, absolutely, and that is so important. I know that there's a stat out there, and I can't remember the exact number, but it's a huge percentage of people that if they're seeking help, especially for behavioral health concerns, whatever that might be. I think the stat that I looked at was specifically was addiction, but if they're seeking help and they don't find a solution easily within the first, I think that was like 40 minutes or some very, 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 very tight time frame, then they disengage for at least 4 or 5 months. It's
Mhm.
a sad stat, but it's really, really important, right? That access has to be there and it has to be active.
It does, and I think we have to work with our staff so that we actually have a staff that has the level of inclusion. So when we look at our staff, do the individuals walking through our doors see someone who looks like them and may understand them and can engage in different ways and understands all the cultural norms, all of the aspects of what they might be going through, and certainly staff with lived experience are extremely valuable in that sense as well.
Absolutely, absolutely. They can relate so much better and so much faster. Yeah.
Yes.
So for someone stepping into a leadership role, especially in behavioral health, what are some of the mindsets or habits that you think are going to be most critical for success?
So Oh, that's a great question, and there are many. But I think what I see with new leaders is I've had an opportunity to mentor some new leaders. You know, you have to start in a leadership role. You have to start stepping away from operations a little bit because you can't do everything. And the most important thing is surround yourself with a great team who is good at things that you are not good at. I can't be good at everything, and identifying clearly what are those gifts that I have to bring to the team, and then surround myself with a team who knows things that I don't know, who can do things that I can't do, and maybe don't even want to do, and then trust them. I have to learn enough about their role to supervise them, and I have to learn enough to ask the right questions, but I need to just let them go, and not trying to micromanage. There's a lot of vulnerability that you experience as a leader when you do that, because you kind of have to hand over the reins to some things, but you have to have a good team. We serve close to 17,000 people a year. I have a staff of close to 1,000 to 1,200 if all of our positions were filled. You know, there is no way that I could actually have my hands on everything. So you've got to trust. And you've got to develop that team. That to me is probably the biggest thing, because I think a lot of folks, when they get into that leadership role, they want to still have their hands in operations if that's kind of where they're come from. They want to have their hands in maybe the clinical piece if that's where they're come from, because it's what's comfortable and what's known to them. The other thing is you have to be willing to make some hard decisions and push the team. You have to be willing to be unpopular at moments to help a team sort of get there. And I think the last thing I would say is when you've got team members who might not be getting along or may have a difficulty coming to a consensus or collaborating, don't jump in and solve it for them, because you'll never stop doing that. I think what you've got to do is you've got to really leave it to them to sort of work it out and come through the best decision. So I think in some ways you've got to be a consensus builder, but you really have to also drive the team towards outcomes and keep very focused on where you want to go. I think leadership, one of the hardest things I see is that in a leadership position, you have to have that vision around, I'm not getting engaged in the crisis of today. I'm really thinking about where do we need to be in 5 years to still be sustainable and viable and here. Right, that's your responsibility as a leader. And so you've got to keep your vision out on the horizon while not losing touch with the people behind you that you're trying to lead in that direction.
No, absolutely, absolutely. I think one of my favorite quotes is, as a leader, we have to live in the present, we have to be fully present while focused on the future. Always, always, always,
Yeah.
always. We cannot
Yeah.
just be focused on right now because we lose the big picture, and that's our job at the top, right? Is to see farthest, which makes
Yeah.
complete sense.
It's hard
Yeah.
when your staff want you to get involved in the crisis and they want your opinion on the crisis. Sometimes it's very hard to leave your hands off and say, hey, I've got full confidence in you that you're going to make the best decision and I'm here to support you, and let them do it. Yeah, that can be really hard as a leader.
Absolutely. It's hard even if you fully trust them too, right? Like even if you're new to the role, then you might not fully trust them yet, but you have to kind of make the conscious decision to trust. Even if you instinctually trust your team, it's hard to not be pulled in because it's almost sometimes it's almost like the crises are the fun things. It's the exciting part of the job, even if it's not a good crisis. And it's
Yeah.
it's hard to say nope, I can't play there. That's on your list. Um One of the last couple of quick questions I want to ask. We are a specialist team in behavioral health. That's all we do is market in behavioral health. What does your team do right now to gain new clients? What's working really well for you?
So I think what we have done, and we really, and this is interesting because with a background in marketing, I've always
Yeah.
kind of in behavioral health, I kind of take a soft focus towards marketing, not so much as a hard focus. Of course, we're a nonprofit and a governmental entity, so we're an instrumentality of the state of Georgia, and so that changes sort of our, sort of how we are. We're codified in Georgia law, so that changes a little bit how we operate from just any other sort of nonprofit out there. But I've always felt like sort of a soft focus is really interesting. And I think it is linked with operational, what we do operationally and with our stakeholders. So I feel as though we have a very targeted group of individuals who we serve. Again, it's those individuals with very, very complex mental health, substance use, and intellectual and developmental disability needs. And I think what we've done over the last several years that I feel like has been really successful is really engaging with our stakeholders in different types of opportunities in how we engage with people and knowing that we're actually out there. We do have kind of a soft marketing focus with some videos and some, some outdoor media and a lot of just sort of speaking engagements. So one of the things we've done recently is develop a Connect Institute. And so this is a training institute where we take many, many different behavioral health topics and work with our stakeholders to provide training and support around all things sort of behavioral health related. But the other thing that we've done is just right down to the individuals who we serve is identifying ways in which we can get out into community, place our direct care staff into the community that can engage in very, very different ways. If you are involved with the justice system, we likely have a clinician there who actually can go ahead and engage with you in your assessment there before you ever actually have to walk in our door. You may be in a local emergency department and they've discharged you, but you need to be connected to services. We actually have someone right there, posted in that emergency department to say, hey, let me go ahead and get you connected, and then we can keep in touch with you. So those are some of the ways in which we've tried to impact access, but also just awareness with our stakeholders of getting people connected to the services that they need.
Absolutely. And that can be so hard to keep your local partners engaged and educated, because they have a million other priorities on their list as well, right? They're working hard to maintain basic physical medical health access to clients, and so it's often very hard
Yes, they
to
do.
keep them engaged.
Yep.
Last question then, still on that marketing trait. What is one new marketing tactic or marketing strategy that you or your team is considering, or just maybe even just watching in the marketplace right now?
Yeah, so I would say we're trying to do a little bit more direct marketing, and we actually have had a long history of commitment to serving veterans, and we can serve veterans regardless of their discharge status. And trying to reach veterans can sometimes be a challenge. Trying to get a veteran in the door can be a little bit of a challenge. And so that's one of the areas where we've really focused on how do we actually reach veterans, where are veterans that we can get to them, and how do we develop materials specific to something that they would actually connect with. And so we use we've got a new what we call a veterans outpost. It's an outpatient clinic just like all of our other clinics, except it is veteran specific, and we hire veterans to work in that capacity. And so our clinicians and case managers and peers are all veterans as well. But another one I think that I love is we've started with what we call a recovery friendly workplace. And so we've started to work with chambers and with local businesses to develop what we call a recovery friendly workplace. And so what we feel like, particularly in some of the workplace challenges that lots of folks have had, I mean, no matter what industry you're in, there have been those challenges, is we actually have a ready workforce that wants work, but some folks may consider them to be unemployable. We don't. We actually think that folks who are actually in recovery are probably some of the most supportive folks that you could actually have working in your system. And so we started to work with those providers and those companies to develop those relationships and say, how can we train you on what does supervision look like in a manufacturing company when you have recovery individuals that are working on your line? How can we train you? How can we train your supervisors to be a more recovery friendly workplace so that you can provide all of those supports and also engage in a ready workforce that will be very committed if you can provide the kinds of supports that they need. So that's some of the ways that we've been very excited, and we see there's sort of a dual purpose. We can actually offer connection of employment opportunities to those we serve as they're coming out of maybe one of our residentials, but we can also sort of engage with the community around how do we actually just create a more inclusive community in working with chambers and employers to understand recovery in a much broader sense.
I love that. I love that. Well, I want to call out something as praising you and your team. Both of those approaches, both the veteran outpost and the recovery friendly workplace, is a really good example of meeting your audience where they are and doing what is going to work for just them. I think a lot of leaders often get distracted by, well, we can't apply that to every other population, so we shouldn't bother. We're like, every solution has to solve every problem for every audience, and I really like that you're focusing just on one problem for one audience at a time. I think that is the way that behavioral health clinics or behavioral health community centers really should be serving those individual populations, because their needs are different. Each population has a totally different set of needs. Well, thank you so much. We appreciate you coming on, and I appreciate the work you're doing in your community. I know you're making an impact, and you and your team are doing good work. So thank you.
Thank you so much, Timothy, and thank you for having me. It's been a real honor to join you and your audience today to talk about behavioral health.